Hello, welcome to my channel. My name is Nurse Pauline RN. I upload my videos on Tuesdays and Thursdays, Eastern Standard Time. Today I'm going to be talking about assessment and diagnosis. It's ADPIE of the nursing process. A stands for assessment, D stands for diagnosis, and P stands for planning, I stands for intervention, and E stands for evaluation. The goal of my videos are to assist nursing students to pass their fundamentals of nursing exam. Before I get started, please hit your like button, please hit your subscribe button, and please share my video, and please comment at the bottom. Assessment database. The initial information about patients' physical, emotional, social, spiritual health, referred to as the initial overall assessment. Client assessment results, medical and diagnostic reports. Client assessment is related to physical, emotional, sexual, psychosocial, cultural, spiritual, cognitive, functional, age-related, economic, environmental information, subjective and objective. Assessment data must be descriptive and concise and complete. Assessments before intervention always. Not intervention, then assessments. Assessments comes before interventions. Assessment data may reveal interaction with prescribed medication, with dietary supplements, vitamins that are part of patients' cultural practices. Your own hospital may have policies, may set time frame for when assessments should be conducted and entered. Nursing assessment is different from a nursing assessment is different from medical assessment. A nursing assessment is holistic, focused on patient's response to disease, pathology, and other stressors. Medical diagnosis focuses on disease pathology only by a doctor. Assessment involves data collections, systemic and ongoing process. It's a recording data. It's a categorization data. Assessment during admission is to find out what is the greatest concern the patient is dealing with. Assessment by palpation, you feel the skin, evaluate pain. Assessment by auscultation, listen to the heart rate, breath sounds. Assessment by percussion, by using your fingers. Focus assessments are information that provides details about specific problems and expands the database. Organization of data is grouping related information. Developmental assessment is working with children, gather data, assess verbal skills and comprehension. Nursing assessments are similar to medical assessments. Both collect data about physical problems and disease symptoms. When you assess your patient, first you do a physical assessment. Know the medical diagnosis first. You have to know your medical diagnosis. Know the pathophysiology of the disease. Look, listen, feel, smell. Use your senses to document. Objective, subjective. Abnormal presenting symptoms based on your head-to-toe assessments. These are all your assessments. Here we have your nursing diagnosis. After assessment, you gather all your data. Focus on what is going on with your patient. You focus on oxygenation of your patient. We're going to focus first on what is going to kill the patient. What is going to happen to this patient in the next half an hour? Am I going to be calling the meds team? Focus on oxygen, blood pressure, heart rate, ineffective airway clearance, congestion, shortness of breath, wheezes, difficulty breathing, decreased level of consciousness, stroke, risk for falls, edema. Does your patient have signs and symptoms of maybe a blood clot, redness, swelling, warmth, pain of the legs? Assess dehydration. Assess urine output, less than 30 cc's an hour. Assess your patients for signs and symptoms of a seizure. Assess your diagnostics. H&H low, maybe your patient may need a blood transfusion. Assess elevated temperature, signs of infection, elevated or low heart rate. Post-op patients, you assess these patients. Make sure the post-op patients are able to void after surgery. Very, very important. More than 30 cc's an hour. Assess your post-op patients for signs and symptoms of hemorrhaging. Assess the surgical sites. Assess respiration. Is it tachy? Is it too fast? Is it too low? Assess the patient's glucose. Is it elevating? Is it elevated? Is the glucose too low? When analyzing all these data, the nurse examines the functional health patterns of the patient. The nurse examines the trends of the patients. When formulating a nursing diagnosis, the nurse examines the functional health patterns of the patient. Risk diagnosis is the case in which client is vulnerable to develop health problem. That's your risk diagnosis. nursing diagnosis, health issues that can be prevented, reduced, resolved, enhanced. Please hit your like buttons, please. Please hit your subscribe button. Nursing diagnosis, health problems that can be prevented, reduced, resolved, enhanced through independent nursing measures. Etiology is cause related to, refers to what causes the problem. Diagnosis is based on assessments. Diagnosis from NANDA. Potential or risk diagnosis. Please assess for risk or potential problems of your patients. Diagnosis is related to 1. A health problem. 2. Actual diagnosis is problem that currently exists. The nurse describes the component of the nursing diagnosis as defining characteristics, as problem, as etiology, cause. The nurse describes component of a nursing diagnosis as 1. Defining characteristics. 2. The problem. 3. The etiology or cause. In order to identify nursing diagnosis, 1. Use best data collection. 2. Use body systems model head to toe. Body systems model introduces holistic database that is useful to identify nursing diagnosis rather than a medical diagnosis. The purpose of the nursing diagnosis is to identify patient's problem and etiology, cause. A nursing diagnosis is response to actual or a potential problem, as evidenced by, to show you know there is a problem. As evidenced by refers to how you know it's a problem. As evidenced by, presenting problems are the objective data. As evidenced by are the sign and symptom presented. There is no evidence by in risk. It has not happened as yet. Analyze your data cluster. Please hit your like button. Please hit your subscribe button. And please share this video. Please comment at the bottom. Thanks. I will see you on Thursday in the afternoon Eastern Standard Time. Be blessed. Take care.